Good morning, esteemed members of press and media. With the permission of Dean Sir, I would like to start the press conference.
Yes.
Today we have gathered here for a press conference on a project entitled Mission, a multi-centric capacity building initiative to strengthen the clinical and laboratory detection of melioidosis in India with special focus on the north states. I would like to introduce the esteemed members of the team from SMIMS and the team from KMC Manipal to the members of press and media. Dean Sir, Dr. Muralidhar V. Pai, Dr. Chiranjeev Mukhopadhyay, Professor, Department of Microbiology, KMC, and Chief Principal Investigator of the project. Dr. Tejaswi S.C., Professor and Head, Department of Orthopedics, and Clinical Co-PI of the project from SMIMS. Dr. Varun Singh, Professor, Department of Surgery, and Clinical Co-PI from SMIMS of the project. Dr. Deepan Gautam, Department of Microbiology, Co-PI of the project from SMIMS. Dr. Mohammad Ashik, member from KMC. Dr. Ms. Pranomita Chakrabarti, SRF of the project from SMIMS. I am Dr. Luna Adhikari, Professor, Head, Department of Microbiology, SMIMS, and the Principal Investigator of the project. Now, I would like to request Dean Sir to address the press conference.
The project is recognized to be done in SMIMS, Sikkim, as one of the centers. We are also grateful that SMIMS has been chosen as one of the key centers for this project, which has been just informed by Dr. Luna, that is Mission, a multi-centric capacity building initiative to strengthen the clinical and laboratory detection of melioidosis with special focus on northeastern states. Through this initiative, our faculty members have been equipped with the necessary knowledge and skills to enhance the diagnosis of melioidosis, both clinically and in the laboratory, and to ensure timely and effective treatment for affected patients. This project has strengthened our institutional capacity, enabling us to contribute meaningfully to public health and infectious diseases management. I would like to briefly inform you about melioidosis. It's a potentially fatal infectious disease caused by the bacterium Burkholderia pseudomeli. This disease is commonly found in tropical and subtropical regions, particularly in Southeast Asia and Northern Australia. It spreads through contaminated soil and water, mainly affecting humans and animals through inhalation, ingestion, or direct contact with the broken skin. Melioidosis presents a wide range of symptoms from mild fever to severe pneumonia and septicemia, making it difficult to diagnose because it camouflages itself and very difficult to diagnose. It is especially dangerous for individuals with underlying conditions like diabetes or kidney disease. Without proper treatment, it can lead to life-threatening complications. Given its high mortality rate and potential for antibiotic resistance, early detection and appropriate antibiotic theory are crucial. Raising awareness about this disease, especially in endemic regions, can help improve diagnosis, treatment, and prevention strategies. So, we are happy that SMIMS has been chosen as one of the centers for this particular research project. So I would request now the chief of this project, Dr. Chiranjoy, to tell us more about this.
Thank you, sir. Very good morning to all of you. Very good morning to my esteemed faculty here. And I'm thankful that you are all attending this one. We want to convey a very important message to all of you about an emerging tropical disease. The disease, as mentioned, it is called melioidosis. Sometimes it is called soil fever. because the bacteria Bacillus pseudomyeli is in the soil and water, and any person who gets exposed to soil and water, especially if they are diabetic, if they are having kidney disease, they are chronic alcoholic, they may get the disease, and many times it is fatal, it is life threatening. Maybe sometimes out of 5 patients, one may die, especially if they come in the heavy rains, they come with pneumonia, they come with bloodstream infection, or they come with bone and joint infections. If they are not treated immediately and not diagnosed, the outcome may be very fatal. We are very fortunate to have a very good laboratory setup in SMIMS, and SMIMS is the nodal center for this particular disease in Sikkim because of their excellent laboratory capacity and the expertise that they have developed. So any such disease, if can be suspected by any clinician, our main message is for the clinicians. Two clinicians are there with us and they are trying their best that we can save human life. If clinicians suspect the disease and they refer to the microbiology laboratory, the microbiology laboratory is able to diagnose the disease at the earliest opportunity. And if they diagnose, the treatment is available. And the antibiotics are available. If the antibiotic is given at the right dose for a right duration, human life can be saved. So you understand the most important message about this, that one diagnosed means one human life is saved. So we are here all together to convey this message through you to all the clinicians across the state and all the microbiologists across the state and the public health officials and the government authority that this is a disease which is very much prevalent but underdiagnosed, misdiagnosed. If it is not diagnosed and if it is misdiagnosed as other diseases like tuberculosis, leptospirosis, scrub typhus, the treatment will be wrongly given and the patient will never be cured and they will have a very fatal outcome. So diagnosis is important. In many states of Northeast now, once they were not diagnosing this disease at all. So patients were going down to South and getting them diagnosed. So when we look at the data from South hospitals, the reputed hospitals from the southern part of India, many of the patients who have traveled from Northeast and they have gone to the South and they got diagnosed. So we can understand that how many patients who got misdiagnosed or underdiagnosed here. Now once we started the project in Northeast like Mizoram, Assam, Tripura, Manipur, Meghalaya, all have started diagnosing melioidosis and many human lives are being saved. One center is in SMIMS, Sikkim, and they are having the exact capacity, appropriate capacity and the awareness. So please take the help. Through you, I want to convey the message to everyone. Please take help of them. Any patient who is suspected to have pneumonia, bloodstream infection, bone and joint infection, deep abscess in the body, liver abscess, spleen abscess, prostatic abscess, parotid abscess, cervical lymphadenitis, subcutaneous abscesses, or the patients having meningitis sometimes. If you suspect, please refer to the laboratory here, consult the clinicians here who will help you diagnose melioidosis. If not melioidosis, you can get another diagnosis, but it will never be misdiagnosed or underdiagnosed. This is the message from our side. So, keeping this center as the nodal center, we are now as a hub and spoke model we are following and we are connecting the peripheries. So there are 4 PHCs. One is Temi, Nangthan, Meli, Rangpo. These are the 4 PHCs we have already connected and we have visited them and we are asking them if they suspect any patient. We are having two district hospital, one is Namchi and Singtam. They are a part of this project, and we have one CHC is Renok. They are a part of this project. So we are now expanding it more. More the awareness will be done, more number of patients will be diagnosed. So in this way, this is a project taken which has been conceptualized by KMC Manipal with the help of ICMR, and we are very grateful to ICMR for funding us to explore the opportunity to diagnose this emerging tropical disease, and we are now trying our best so that we can diagnose more number of cases and save human life.
Yeah.
So thank you, Chiranjay sir. And most of the things regarding melioidosis has been shared by Dean sir and Dr. Chiranjay sir. And in addition to some of the additional information that I would like to give, so it's a multicentric study, 17 centers are involved. So one is the regional center, that is KMC Manipal, and one is the nodal center, that is RMRC Debrugarh, and 15 are the participants.